This is Gambia, home to around 2.3 million people. Even though it's the smallest country on mainland Africa, over 10 different languages are spoken by a large variety of ethnic groups. It's called the Smiling Coast of West Africa. Yet this country is one of the poorest countries on the continent. Due to the lack of access to clean drinking water and medical care, Gambia has one of the highest infant mortality rates in the world. Here, development work has been close to non-existent. A 22-year-long dictatorship under Yahya Jammeh prevented the country from attaining any financial or structural aid from other countries, and local corruption was so high that even when the government shifted to democracy, many states remained reluctant to help develop the country.
International development had to wait until 2017, when finally the government shifted into a democratic leadership.
This is Tassilo Küpper. As soon as the dictatorship ended, he contacted 2 NGOs to join forces with him, the US-based NGO Soul Health for a health situation assessment and the local Red Cross Society in the Gambia for the implementation of the strategies that they suggested.
So what Soul suggested to combat the problem of unsanitary water conditions and also the lack of doctors was not just to throw money at a problem. Instead, they suggested to do a capacity building in the communities so that they can, for themselves, be empowered and sustainably continue the project even once we are gone.
The first part of the capacity building is to educate and train community health nurses to strengthen the healthcare system.
My name is Aida Koli.
Bakary Djejuara.
Amar Diouf.
Fat Fofana.
These are 4 out of hundreds of nurses who are currently receiving training or have finished their education. After completing their training, most of these nurses will not continue to assist a doctor. In rural areas, nurses are the doctors. They are trained as midwives, diagnose and treat patients, some even perform minor surgeries such as cataract operations.
Here in the Gambia, there are no doctors in the countryside. We, the nurses, we are the backbone of the health system. We take care of what the doctors are supposed to do.
I normally see 200 patients a day, and the disease that I normally treated is pneumonia, malaria, skin disease or skin rashes.
Diarrheal cases, malnutrition, hypertension and diabetes.
Investment in medical care, however, doesn't just stop after education is completed. Because the rural areas are so poor, young people training to be nurses would often only find work in bigger cities, which means that communities back in the villages hardly benefit from their children's education.
In addition to providing the means for educating the community health nurses, we also reached an agreement with the Ministry of Health, ensuring that they would pay their salaries and post them in the most remote region throughout the country. And we did this to help combat the lack of medical personnel in these villages.
I'm from LRR. I'm being posted back to my region. At the beginning of my training, I was so excited. My family were excited that I'll be a nurse. We don't just only treat patients, we also help students, especially those that are from the school. We also help them and guide them through training.
If you educate and then assign one community health nurse to a village, that nurse has a tremendous clinical impact in and of herself. But because she also conducts preventive medicine training, in other words, trains local people how to prevent diseases in the first place, the cumulative effect is to prevent disease for thousands of people in one village alone over the course of a year. Multiplied by 65 nurses, we're now approaching many thousands of cases that have been prevented.
The second part that the 3 NGOs focus on is basic sanitation. Because of the lack of clean drinking water, many children in rural Gambia suffer from waterborne diseases resulting in diarrhea, skin diseases and even death. A single water well, however, provides water to at least 2,000 people at a time. With the installation of 5 water wells, the 3 NGOs provided clean drinking water to a minimum of 10,000 people of the most vulnerable communities, which immediately reduced the number of waterborne diseases and decreased the amount of time they needed to fetch water on a daily basis.
Almost 1,200 people across the village
are benefiting the water. We are very healthy. If you see different people, this community right now here, look at them and look at their faces and their body. They are very happy now.
What also changed for the locals is that they have a less hostile atmosphere in the communities. Before the installation of the tap, many women got into fights with each other about the limited amount of available water, which some had to travel great distances for in the first place.
Aussi ata otumo janni moja mabe da samale ile bin kasile janni mol ba fol da samu kan nite tata kolonto ka mol tara faare ngel kata fo mon toro wate saba ji wala koleyaka ha.
In order for the implementation to be sustainable, the Red Cross then trained locals to maintain and take care of the wells. Each well has a chosen committee that collects money for the maintenance and makes sure it remains functional.
76.3% of our household waters are contaminated with E. coli. We are having a lot of infant mortality, which are associated with diarrhea. And we all know diarrhea mostly is because of the kind of food you eat or the water you drink. The 5 water sources provided water to 10,000 people, which is one of the most effective projects in this country.
Composting waste is the other side of increasing local sanitation. Open defecation leads to contaminated water, which, upon being consumed, creates a cycle of infection. In order to break this cycle, Seoul Health suggested an evidence-based strategy that involves not only the construction of latrines, but also the education of locals by the local Red Cross Society in Gambia.
Latrines don't just prevent the spread of airborne and waterborne diseases, but also provide the safety for women who are exposed to threats by men when the only option is open defecation.
We conducted community diagnosis to see the perception of women within the communities. So we realized that most of them, they do open defecation, but they don't like it. But they don't have the means because women are not powerful enough to build latrines for themselves. So when they go to the field and they can meet with men, they can be raped or anything can happen to them, which is very unsecure.
What makes the latrine system sustainable is how they are built. Every latrine has a ventilation system and 2 pit holes that are used alternately. When one pit hole is full, it's sealed with cement until the waste has decomposed and can then continue to be used as fertilizer, while the second pit hole is used as the new waste container. This prevents wastewater being tossed into local water bodies.
By focusing our intervention on the poorest people in the Gambia, our impact will be multiplied by people that are trained by Red Cross, of course in partnership with Seoul Health and UB1 in the project.
Our mission relies hugely on the support of people like you. Please consider donating to the Healthcare Support and Strengthening Project in the Gambia so that you can make a huge impact on the lives of thousands of vulnerable people, many of which are women and children throughout the country.
If you are looking for a cause to donate to, just get in contact with one of the 3 NGOs about this project, and your donation will help improve the lives of thousands of people today.